Come on. Am I right to leave here? I need to go and see the next patient.
What's the story of this chap?
So I'll give you a quick handover. This is Brian Briggs. He's a chap in his 80s who's having a right Thompson's hemi-refractive neck of femur. He's a little bit frail, but he's had his left one done last year after another fall. He's got a background of having had a stroke and ischemic heart disease, so he's done him on a spinal. He's had standard spinal dose, it's all documented. Below metramidol. I think they're happening really well. So he's had a couple of doses of metramidol. It's all on the chart.
Excuse me, Georgie. I'm your anaesthetic nurse today.
Is that all right if I nip off to go and see the next patient?
All right, you're doing all right there,
It's all on the chart.
Mr. Smith.
Nice, straightforward, Henry.
Pretty well, thanks.
Good stuff. Right, nice.
Getting close.
There we go. Fluids.
Right.
We're just replacing fluid line. I'm just your anaesthetic nurse. How are you doing? Nice to see you.
Right, one of the anaesthetic SHOs.
Hi.
How is he doing? Stable so far?
Yeah, so we've got saturation 99, blood pressure 101/73.
Excellent. Fine.
Pulse is 101, so it's a little bit on the high side, but we're getting some fluid through.
Are you all right there, Brian?
Fine.
I am all right, thanks.
Oh, good lad. He's quite an entertaining bloke, actually, aren't you, Brian?
Yeah, I'm doing well.
What will you be doing today, Brian, if you weren't here?
I could be down the pub with trainers.
Down the pub with your mates? Really?
11 o'clock.
Oh, we're just
That's early in the day.
We're in it.
we're very much
Exciting.
looking at these
There, isn't
fluids,
it?
yeah.
Me not putting them together properly, isn't it, eh? Do you know? Can't get the anaesthetic nurses these days. I think. Should be alright, that.
I'll have that syringe as well.
I'll keep fiddling with that.
Are you a football fan, Brian, or?
Blackburn Rulers.
How are Blackburn doing this season?
Fantastic, like every season, lad.
So,
Is he confused? Sorry,
Well,
I'm only
cement,
joking there, Brian. Are you what?
cement.
Oh, you cement it. Oh, yeah, alright.
So,
Everyone happy?
Is our blood pressure cycling?
It's from money. Actually, it looks. Just a minute. Let's put that. Do you want to? That looks like it needs to be an auto.
Yeah.
That's me. Sorry.
Get yourself happy now.
Andy did say, could I put it on auto?
how do I?
Because it slipped onto manual. Sorry about that.
Okay, I'll start if everyone's happy.
Yeah.
Do you mind if we just get that blood pressure first? Sorry.
Yeah, no problem.
Oh yeah.
I'm sure it'll be fine and then you can crack on.
Dizzy.
You're alright there, Brian. We're just waiting for this blood pressure.
Feel very well.
Okay. What way don't you feel well?
Okay, cement's going.
Everything's spinning a bit. You look like you're moving.
It's spinning.
Okay. It's got good blood pressure and it's got a good pulse.
Yeah.
Cement's going in.
Okay, cement's in now. So, that's done with, thank you. So, we'll start towards getting back together and closing up. So, around there, that's great, thank you.
The sats are dropping slightly, aren't they? Is that
Yeah.
that looks oxygen around? We'll whack that up a bit.
I really feel a little bit funny, right?
What way does it feel funny?
I just can't seem to get my breath. Just
Shall I have a look?
really struggling.
Yeah, do you want to pass me
Got some
the
tubes. Okay, let's go and whack that up to 15.
I'm just going to have a quick listen to his chest there.
Are you alright?
I've got some pain around the front of the chest. It's all a bit tight, like.
Okay, too wheezy at all.
I'll just take this, that one.
No, we've got bilateral air entry, no wheeze, no
His
contact.
sats have dropped a bit, haven't they?
They have. I've just whacked them to 15 litres.
Have you?
How long left have you got on the operation?
Just sort of push the close up really, not too
Gone tachycardic. Have we got the quick reference number?
Somewhere. I can go and try and find you one.
Do you think cement embolus?
I'm thinking cement embolus.
Yeah. Why, what's happened?
So it's gone dizzy, tachycardic, and his stats have dropped just after the cement's gone in.
Right.
So we're worried about a cement embolus.
Oh.
Okay.
Oh, right.
We lost.
Okay.
There's our blood.
What can I get you?
Okay, so hypertensive. Right,
I have
do you mind
some
if we...
metramidol.
Are
Can you
you
bring the
closed or
adrenaline
is
as
it
well,
closed or...?
There's your metramidol. What?
Can we move in? Can we get him on his back if that's
Yeah,
okay? Do you mind
please.
giving me a hand? Should we get him on his back? Brian, we're just going to get you on your back, okay? And then once he's on his back, could you elevate his legs, please?
Do you want to get some iodine on the surgical field, or? Don't know.
Okay,
So it's had a miller's and a terminal there.
Okay, there's 100 mics, mil adrenaline. Oh, blimey.
Okay, what have we got? Have we got a pulse with that?
Well, that doesn't. Is that his rhythm? Is anyone moving?
Looks like the have we got
You just got to put some
pulse?
pressure on that
We've
one,
not
don't
got a pulse. Could we start chest compressions?
Oh, good God.
Gareth, do you want to start chest compressions?
Yeah,
Are
I'll
you
do that.
alright taking over the airway side of things?
Yeah.
Yeah.
Just gonna pop an eye gel in if you're happy with
Okay,
that.
and can we get the pads on? Should we call some help as well? Are you alright calling some help while I'm just going over pads?
I think, do you want to do chest compressions? We can do that.
Yeah, if you take on from me and then I can help these guys, that'll be great.
Fine,
Okay. 28, 29, 30.
Perfect. Des, where are the pads? Right.
Right.
Pads over
Deep
here.
pads, I'll get them.
You get
So
the
I'll sort these
pads.
out.
I'm going to call some help.
Right, okay. Are we plugged in?
Yeah,
No,
yeah.
we're not plugged in. Good. Yeah. What a day.
I just want to put out the arrest call, please.
Yeah, please continue compressions. Continuous compressions, please. Let us know when you get tired and then we can swap you around.
Thank you.
Right,
8 adults.
just going to try and put pads on, work around you. You keep doing compressions, I'll work around you.
Okay, have we got the pads on?
We're getting there.
2, let me connect. I've got this.
Des, are you
Okay.
happy operating the defib?
Yeah,
Yeah, ideal. Are you able to keep switching for chest compressions?
I've done me.
Yeah.
Yeah.
Okay, have we got the pads on? We got the defib on. Could we have a rhythm check, please? Can we stop chest compressions, please?
Right, so it looks like we've got a shockable rhythm.
Could you get back on the chest? Everyone else away, please. Des, I'm giving it over to you. If you could perform a safety.
Right, okay, so we're defibbing.
Step back.
Just need energy select 150, okay?
Sounds good.
150, right. I'm charging, stay on the chest. Keep doing chest compressions while we charge. Everything else is away. We're charged. Right. Okay, stand off the chest, please. Away from the chest, everyone away. Straight back on the chest, please. That's defibbed. Right.
Perfect. So
Okay.
when you're ready. Sorry, do you mind swapping in with him? We've got an airway in. Are you happy from an airway perspective?
I'm happy from an airway perspective. I could do with some CO2 monitoring, which is
Perfect.
coming through here, but it's not showing up on the screen.
I'll let you sort that.
Oh yeah, we're getting some anti-idle there now.
In terms of possible causes while we're here, so Des, have we got actually we won't have an outline or anything. Are you able to get gases? Take a blood gas or
Access might be tricky. I can try and get them from this side if you want, yeah?
yeah?
I'll give that a go.
Perfect. Just needs a VBG or whatever, or an ABG if you can.
Yeah?
Fine. So, what access have we got? What cannons have we got in on him?
He's just got
So
one
one grey cannula in his right,
grey
yes.
right forearm.
Fine, and we're happy with that. Fine. So, in terms of possible causes, while Des is getting that gas, so hypovolemia, he has had a spinal. I think it's worth. We got that fluid connected and running.
It is, yep.
Yeah, is that just normal saline or Hartmann's or something like that?
Yeah, it's normal saline.
Yeah, should we just get that going through as fast as we can? In terms of other potential issues, so hypoxia is a potential cause, but we're doing everything we can. I'm assuming that's 100%.
Yeah, we're
is
on
that
100%
right?
on there. We don't have any gas on, it's just oxygen.
What was his temperature during the operation? Have we done a temperature yet?
We haven't, but I wouldn't have thought
I
he would
wouldn't
be
have thought he
hypothermic.
doesn't. Did he feel particularly cold?
He doesn't.
No. So, and Des is doing a gas to rule out hypoglycemia and hyperkalemia.
yeah.
In terms of T thrombus, I suppose it's possible. He's got
Just a bit deeper so I can find the femoral
he's got a history of ischemic heart disease.
Right, got it.
That's probably about 2 minutes. I haven't actually taken the time. Should we do have we got
Yeah,
time
we're
on
on
that?
2 minutes 35 on the
Fine.
defib
Can we
there.
just do a rhythm check if that's okay?
Yeah.
So can we stop chest compressions?
I'm just going to get someone
And
to
what
run with
rhythm have
this.
we got there? We've got a shockable rhythm.
Right,
If you can
so
get back
that-
on the chest
that's
for me. Des has gone, so would you take over the
Thank
defib?
you.
Yeah,
Yeah.
right, so is
So
everyone
everyone aware
aware?
we're about to defibrillate. If you could step back, Des. So we're not going to
don't
shock,
want
we're
to
just
do
going
that,
to charge.
That's alright, I can do it.
Okay.
Right. Right, everyone's aware apart from chest compressions. Right, charging defib. Could you step back, please? Right, delivering shot now. And can you get back on the chest?
So, Des, at the next shock, if we're delivering a shock, we're going to give a milligram of adrenaline and 300 milligrams of amiodarone. If you could get that ready for me, please.
Okay.
Can you let me know when it's 2 minutes?
Will do.
If that's okay.
Right.
So in terms of going through reversible causes, I suppose potentially it could be a thrombus or a cement embolism leading to a thrombus, and I think that's possibly one of our top differentials.
Definitely.
Tamponade, I think, is less likely. There's no history of trauma or chest trauma or anything like that.
No.
Toxins, what has he had on his drug charts? Should we have a quick look and
Yeah.
see what he's had? So he's had...
Swap if it's okay.
So he's had teicoplanin. I suppose if he's had an augmentin, so if he's had a reaction, we've given adrenaline anyway, and
Yeah.
we'll be continuing to give adrenaline. It doesn't sound like that. He's had some metramnone, he's had some midazolam, he's got a spinal anaesthetic in, which will be diamorphine, won't it, which I usually put in. What's his pupils
So about
like?
20 seconds away from the last shock, from the next shock even. They're dilated.
Dilated, so I don't think it's likely to be sort of an opiate overdose or anything
No,
like that.
and it's
Fine.
not
Should we do
attention because it's chest.
Are we at
time.
time for a rhythm check? Could you
Yeah,
have a
time
listen
for
to
a
the
rhythm
chest when we're doing it? So if we could stop chest compressions, please. Okay,
So that is a
we've got. Have
rhythm.
we got a pulse?
We do have a pulse.
We've got a pulse. Okay, we've got Ross. Could you start performing an A to E for me?
Yep.
Have we got any help on its way? We've called for help. Could we make sure ITU are on their way? I'm not sure, based on this guy's
ITU?
background, whether he's necessarily a candidate, but I think we need some sort of critical care involvement at this point.
Yeah, I mean, we've got him back in the surgical course, isn't it?
And he's got a
So,
tube down his throat.
do pressure on
So
that leg.
fine.
Right, so you want me to make sure we've got a consult coming and ITU?
Yes, please.
Right,
Yeah.
I've got the adrenaline and amiodarone
So
now. I'll
we'll
put those
just
by
put
the
those
side.
by the side if that's okay.
Thank you.
So you're happy there, way B? Anything to find? We've got stats of
No,
98.
Test clear. It's got stats of 98. C-wise, we're a little bit hypertensive now, 191 over 180.
Yeah. It's
Heart
probably
rate
adrenaline
61.
dependent.
Heart sounds normal. We've still got some fluid running. All
Lovely.
we've given him in terms of drugs was a little bit of metramnol.
Perfect. In terms of surgery, obviously, I don't want to get him back onto his side or anything like that. How's the wound looking? What's the plan from this?
We'll